Welcome to Wednesdays Weekly, a weekly information session in collaboration with voluntary sector and public sector partners. Today's session is on the integrated care system and is being delivered by Phil Burton. Over to you, Phil.
Thanks. Apologies for the grumpy noises in the background. That's my dog. For some reason, he's not liking people walking past the window today. My name's Phil Burton. I used to be the engagement lead for HMO working for the clinical commissioning group, but we were disbanded in July, 1st of July this year, and moved over to what's now Greater Manchester Integrated Care. So I work for the Integrated Care Board, still doing what I used to do more or less, covering Rochdale, but a growing percentage of the work that I do will also be for GM rather than just for Rochdale, because there's approaches that we need to do across the patch. So what I wanted to do is try to introduce the integrated care system. I'm going to crib from a document that I've been drafting that hopefully does it fairly simply. I won't go through the whole thing, but I'll try and get most of the relevant stuff out of it. And then if you want to ask any questions, just put in any time you want, that's fine. So I'll just get this up, and I'm not going to share it, I'm just going to read it, so bear with me. So the system is now NHS Greater Manchester Integrated Care, and the aim is that it'll deliver over 3 levels. So level 1 would be across Greater Manchester, which covers around 2.8 million people. Level 2 will be what we're calling place, so that for us is Rochdale, the borough, covering around 225,000 people. And level 3 is neighbourhood, the really local level. And neighbourhoods, because of the way they've been set up in Rochdale, I would say they're probably around 50,000 population for each neighbourhood. GM has got 4 big goals that they've set. And these are to help the NHS support broader social and economic development. So we're looking at things like better lifestyle, more and better jobs, stronger communities, preserving the environment. The second one is to help people be healthier and have better healthcare services. The third one, tackle a lot of the inequalities, particularly around the outcomes that people get from healthcare, and make it easier for everyone to access the services that they need. And finally, to get better at using what we've got, basically, we've got a lot of resources that we don't always use in a joined up way, and we don't always use in the best way. So it's about making sure across GM we use the resources that we've got and get better value for money. Because at the end of the day, we're all using public money. So at level 1, as I say, across Greater Manchester, it's a system looking after 2.8 million people, and it's a partnership. And the groups that fit into the partnership are the Integrated Partnership Care Board, which is like a board of directors for the whole system, NHS Greater Manchester Integrated Care, all our provider partners from NHS trusts, so that's both acute and primary care, the Greater Manchester Combined Authority, Health Innovation Manchester, social care providers, and the voluntary and community faith and social enterprise sector as well. In the borough, it's a similar picture. It's again a partnership, so this is the second level. We have a local integrated care partnership board, which I think is taking the place of what used to be the Integrated Commissioning Board. Some of the partners are the Borough Council, social care providers, again, all the NHS trusts, primary care, and as part of primary care, Rochdale Health Alliance, who support primary care, Health Watch, and again, all the voluntary sector community. And the local partnership covers healthcare and wellbeing services and how care can be supported and delivered locally. All the partners work together, so services are provided in a safe, joined up way to meet the needs of local people. And I think that's the key point, that we have to make sure that we're meeting the needs that local people have. And we want to build happy, healthy communities and individuals. So at the third level, as I said, we've got neighbourhoods. There are 5 neighbourhoods proposed in the borough, and they actually fit in with what are the townships at the moment. So there's a partnership, a neighbourhood for Haywood, 1 for Middleton, 1 for Pennine, and 2 in Rochdale. And I think the borders for the Rochdale one are still to be formalised. The others are fairly straightforward because they do follow the borders of the existing townships. And each local neighbourhood board and part will be another partnership. And again, it will comprise local primary care networks. And NHS England has said that primary care networks have to match up to the neighbourhoods, which in most cases works out quite well, apart from, I think, Canal Side primary care network, which straddles Middleton and Rochdale, so there's still work to be done in that area. Other partners are dentists, pharmacists, opticians, social care teams, NHS therapists and community teams, other public services like schools and housing providers, and again, importantly, voluntary community, faith, social enterprise sector. So as I say, in the borough, again, this is the second level, we've got this 225,000 roughly people. And there's a cunning plan for how it'll all work. So each locality or place has a place lead. Our place lead is Steve Rumbelow, the Chief Executive of the Council, who was also what we call the accountable officer for the Clinical Commissioning Group. So he's had a hat in both areas. So he's got the right sort of background. And I suppose his role really is to make sure that what we plan actually happens the way it's supposed to do. We have a locality board that will build healthcare plans for the borough, including improving results for local people and strengthening the finances, which is always a key issue. The One Rochdale Local Care Organisation, which is our LCO, is the key partnership for delivering improving services for local people. So the LCO is a partnership again of the key providers. So you've got the Northern Care Alliance, the Acute Trust, Pennine Care, Primary Care, the local authority, all working together to deliver healthy lifestyles for our local people. We're trying to build this neighbourhood model to help cut health inequalities and to use the assets that we've got in our really diverse communities, and we do have lots of assets out there. What we want for people locally is for our residents to have a good start, to be protected, to have resilience, to have good health, and to be able to fulfill the potential and you know, meet some of the hopes and aspirations that they've got. There are a lot of shared work programs for the locality of the borough. These cover the neighbourhoods, got urgent care, mental health, planned care, children and special educational needs and disabilities, primary care, cancer, and then there's supporting roles that are now more joined up, such as communication. So the local authority and health service communications teams work in a far more joined up way. So we're working to deliver things like comms and engagement, quality and safety, research and development, reducing inequalities, improving prevention, and making the best of what we can have, as well as delivering all those sort of more obvious healthcare services. So we speak about neighbourhoods, and these are sort of the building blocks of the way it's all going to work. As I said, based probably, I think, around 50,000 population, possibly slightly less in Pennine or Heywood. And there will be joined up primary care, community health, social care and other providers, but also tackling the wider causes of health issues, because we can't just sort of deal with the symptoms of people's health. It's, you know, we've got to look at what are the root causes. So, you know, poor housing, poverty, bad environment, all these things impact on people's health. So we need to be involving groups that work in those areas and taking note of how they affect health generally. Neighbourhoods will work on a smaller scale, obviously at 50,000, but that should give them the opportunity to understand communities better and to build the services that meet local need. And as I said previously, they'll all match up with the townships. Each neighbourhood will have a board, and they will be working to deliver plans locally. Each board, I think, the makeup is still to be finalised, but I would hope that other, as well as the usual sort of partners like health and local authority and voluntary sector, we can get some public representation. We need a way for residents and the public to be able to feed their views into the system and to influence the system, but also for the system to be able to make sure that local people know what's happening. And I think clearly at the moment, this just isn't happening in terms of integrated care. We'll try to get to know our neighbourhoods. I think this is key for the neighbourhood boards and all the people who might work in the neighbourhoods, so that we can build up data on what the needs are for local people and help the boards to plan at that local level. And there are issues that will be different for each neighbourhood. So, you know, there may be particular problems in Middleton that are different from problems in Rochdale. And that's where the neighbourhood system should work better, because it will be working at that much lower, more local level with that local knowledge. There will be teams with lots of different skills working across the neighbourhood. So you'll have GPs, some virtual teams, including social care, mental health and voluntary sector, and a strong link to local assets in the community, such as shops, community centres, the many diverse groups we've got. And we are, I would guess, one of the most diverse populations in Greater Manchester. And also local leisure centres and assets like that. Residents and communities need to be included at all stages of building up the neighbourhood approach, and I think we've just managed to get some funding to hold 5 or possibly 6 large events across, or one in each neighbourhood, but possibly because of the way Pennine is actually built around 2 different small towns, one in Milnrow and one in Littleborough, so there may be 2 across the Pennine township. So at neighbourhood level, obviously there are some targets and there are issues that we already know about. And some of those are probably fairly obvious, and we need to help people that are in a difficult position at the moment, and for lots of reasons, unfortunately, there are going to be more and more people in difficult positions, and try to improve the life they have, or at least make sure it's not going to get any worse. So we're going to try to improve surroundings, help people through key life events, help them over the longer term become stronger and healthier, look at mental well-being. Mental health is a really key issue. Improve thinking and relationships with us to help share and be more positive and enjoy life. There are some things directly linked to health that can help. We can push early years and educational catch-up, boost employment skills and income, try to tackle some of the poverty issues and help those that have lost out on a lot of the basics, jobs, houses and things like that. Provide advice, housing support, and unfortunately, food banks, which in a country like this we should never have the need for, but we do. So it's about tackling all those wider elements of health rather than just looking at the sort of the clinical things. And there are some diseases that we know are problems locally that we want to tackle as well. So we know that we've got big issues with cardiovascular disease, particularly in blood pressure. And there are things that can help people to do, like cutting salt in your diet, that can help tackle things like that. We need to help diabetics manage better, improve the speedy diagnosis of cancers and make sure treatment starts quicker and is as effective as possible. And fairly topically at the moment, keep flu levels low, help people stop smoking as well, because we are expecting possibly a bad flu season. Because of COVID and lockdown, people's immunity is not what it was. So it could be that flu becomes more of a serious problem. So I would urge anybody who can get one to get a flu vaccination. We also want to look at things like tackling loneliness and isolation, reducing abuse, promoting and helping with physical activity and increasing resilience. And I was watching the news last night and we were talking about grooming and sexual abuse. I couldn't believe that some of the girls that have been involved in some of these cases are having to wait 7 years for it to get to court. And they've got to live with this all that time. So we really need to do something in those sort of areas. So I don't really want to say any more because it's obviously, there's so much in there. And that's a sort of a quick whiz through what the system proposes. So happy to take any questions. I need to get approval for this document, but we'll circulate it as soon as possible because we need this simple way of explaining it as much as possible if we can. So if you haven't all gone to sleep by now,